think we have to separate a couple of things out when we talk about the Affordable Care Act. One is that it's being heard again at the Supreme Court this week. And so the question of whether the Supreme Court will rule in favor of the Affordable Care Act or potentially knock the entire act down is a big issue that's looming over us all. The Supreme Court decision is really going to be very important. And if the Democrats have Congress, both the House and the Senate, and even if the Supreme Court rules against the ACA, Congress can turn around on day 2 and implement a tax, and the whole thing goes away and the ACA remains. So it's really going to be important that the Democrats, if they want to be able to have control and be able to lift the ACA and support the ACA, they really need to have Congress on, both in the House and the Senate. So some of the bigger pieces I think that are likely are things like making healthcare a little bit more affordable for people, giving them access to plans that have lower deductibles, giving subsidies to people higher up on the income level. I think that those are probably more likely outcomes that could build on the Affordable Care Act and make it stronger. I think some of his other ideas, which include expanding Medicare to ages 60 to 64, and also including a public option for people to choose whether they have access to employer-sponsored health insurance or not. Those are a little more controversial, and even if I think the Senate and the House are all Democrats and we're all, rowing in the same direction, I still think those might be plans that are less likely to pass Congress. We still have this issue of people in the country not being united on what the response should be. I do think we're going to see a lot more coordination at the federal level and a lot more assistance to states to help them move forward with their plans. I do think we're probably still going to see some differences, though, in how states actually implement even federal rules or mandates. I think it's very difficult for the federal government to intervene at the state level. I think President-elect Biden is certainly a good person to have at the helm to be able to cajole governors and mayors to coordinate these efforts and help move forward on some of these policies. But I think it's difficult to get people to change their behavior and to respond to some of what we're seeing, which is really new for all of us. I think that there certainly are things you can look to, like better guidelines, better coordination of PPE and supplies to schools, funding from the federal government to state governments so that they can distribute that funding to local school boards and have that be more coordinated, PPE be more coordinated across the country, data be more consistent across states, having all of that. But whether we're going to see a complete 180 and things are all of a sudden going to be great, I think that's a little too hopeful. I think I'm definitely more pragmatic in thinking about this and thinking that it really would have been better if these things had been done right from the beginning and set the tone